Picture this. It's dusk. You're looking out into a yard, and standing right there is a fully grown adult Great Pyrenees.
Oh, such a gorgeous breed.
Right. Broad through the chest, that signature double coat catching the very last light of the day.
Yeah.
The dog just scans the fence line slowly, methodically, takes a breath, turns, and calmly walks back toward the house.
It is the absolute picture of a stoic, majestic guardian dog. I mean, watching that, an owner's natural instinct is to assume total biological stability, like everything appears completely flawless.
Totally. And that quiet moment, that illusion of perfect health, is actually where true preventative care begins, because we aren't looking at, emergency room dramas today.
Right.
We are looking at the quiet discipline of noticing. So for today's deep dive, we are pulling from a really comprehensive guide specifically focused on adult Great Pyrenees care.
Yeah, to figure out how to navigate those prime adult years.
Exactly. We're taking the scattered data points from puppyhood, nutrition, and breed behavior and synthesizing them into a daily philosophy for you, the owner. So, okay, let's unpack this.
Let's do it.
Preventive care in a dog's prime years feels like, well, it's like inspecting the foundation of a house when there are absolutely no cracks visible on the drywall.
That's a great way to put it.
It feels deeply counterintuitive to go looking for structural weakness when the building is clearly holding steady. But, that inspection is the only way to ensure the house actually keeps standing.
It is. And the prime years represent this massive psychological trap for an owner.
How so?
Well, think about it. When the dog is a puppy, you are hypervigilant because their immune system is naive, right? Everything is a potential hazard.
Oh yeah, every weird lift they eat is a crisis.
Exactly. And then when they reach their senior years, their fragility is visually apparent, so you naturally adapt your care. But those middle years, they really mask the reality.
Because they just look so strong.
Yes. They aren't visibly struggling to stand up or, exhibiting an obvious limp. That creates this false sense of security. It offers a window where structural and internal strain can quietly compound, totally unnoticed.
Until it manifests as a crisis later in life.
Exactly.
And the most insidious element of that masking effect for this specific breed is sitting right there in plain sight. I'm talking about that massive white coat.
Oh, the coat. It's a biological marvel, but it operates as a total visual smokescreen.
It really does. You just cannot rely on a casual glance across the yard to tell if a Pyrenees has gained 10 pounds of fat or lost 5 pounds of critical muscle mass along their spine.
You can't. The fluff completely obscures the skeletal structure.
Right.
And that brings us to a really fundamental medical intervention, which is weight management.
Right.
Carrying excess weight is not a cosmetic issue. It is a compounded mechanical stressor.
So it's wearing them down.
Exactly. Every extra pound on a dog of this scale exponentially increases the concussive force on their joint capsules, their ligaments, the cartilage.
Just from moving.
Every single time they stand up from a resting position or navigate a stair, over months and years, that mechanical overload just accelerates osteoarthritis.
Wow. I want to push that further, actually, because the physical stress goes beyond just orthopedic wear and tear.
Oh, absolutely.
We're dealing with a breed that possesses a physiological baseline designed for alpine environments.
Right, freezing temperatures.
Yeah, so their thermoregulation is already challenged in warmer climates. If an owner lets that dog pack on a thick layer of subcutaneous fat, they are essentially, they're wrapping the dog in internal insulation.
And the cellular reality of canine thermoregulation makes that extra fat incredibly dangerous. Dogs cannot sweat through their skin like we do.
Right, they just pant.
They rely on panting, which is exchanging warm air from their lungs for cooler outside air, and vasodilation.
Which is the blood vessels expanding.
Yes, expanding in their ears and paws to release heat. But when you add a layer of adipose tissue, or fat, you physically trap the core body heat inside the animal.
That sounds miserable in July.
It is. In the summer months, a heavy Pyrenees is constantly fighting a losing battle to shed internal heat. It puts an enormous strain on their cardiovascular system and puts them at a really high risk for heat stroke.
Okay, so I'm trying to picture the practical application of this. We know from the source notes how quickly treats add up.
Oh, so fast.
Yeah, you've got a multi-person household where someone is inevitably slipping the dog a piece of cheese or table scraps.
It always happens?
Right, and the dog looks completely happy, bouncing around. Since visual checks are useless against that thick coat, how does an owner practically manage this? They need a tactile method to break through that illusion.
Well, what's fascinating here is that the solution involves repurposing a totally mundane chore.
Okay.
Grooming. Grooming for a Great Pyrenees must be reframed.
So it's not just making them look pretty.
No, it
Yeah,
is not cosmetic maintenance at all. It is a rigorous physical inspection.
I like that.
Every brush session is a hands-on body condition assessment. An owner needs to physically place their hands on the dog's rib cage.
What are they feeling for exactly?
The ribs should be easily felt without applying heavy pressure, and there should be a discernible tuck at the waist.
Okay, so you are bypassing the coat entirely to establish a baseline of the dog's physical architecture.
Exactly.
And I guess while your hands are in there, the inspection expands. Like, you are feeling for mats that could tighten and tear the skin.
Yes, mats can be incredibly painful.
And you are smelling for trapped moisture or yeast infections deep down near the epidermis.
Right, you're hunting for burrs or maybe localized heat, which indicates inflammation.
Or new subcutaneous lumps.
Exactly. Doing this in brief, methodical sessions programs your hands to know the dog's baseline topography.
So you notice when something changes.
Yes, the microscopic, slow-moving changes, like a slight loss of muscle tone in the hindquarters or a small cyst, they become glaringly obvious to an owner who has established that tactile memory.
That makes so much sense. But the physical inspection naturally extends beyond just your hands-on brush out, right? You have to observe the biomechanics of that physical structure in space.
You do.
Because the sources outline very specific mobility patterns to watch, and it goes way beyond whether the dog can still just run a fence line.
Oh, way beyond. We have to watch the transitions.
The transitions.
Yeah, like, how does the dog rise from a hard floor in the morning? Is there a micro-hesitation? Are they transferring their weight to their front limbs to spare their hips? When they navigate stairs, are they utilizing a fluid gait? Or have they started hopping their back legs together?
Sort of bunny hopping to avoid bending a joint?
Exactly, to avoid articulating a specific sore joint. We also really need to observe the recovery window.
Meaning after exercise.
Right. Following a burst of heavy activity, how many hours does it take for their breathing and mobility to return to standard resting parameters?
Well, and we can modify the environment to mitigate some of this.
Definitely.
Like placing non-slip rugs on hardwood floors. That eliminates the micro tensions their muscles endure just trying to maintain traction all day.
That's a huge help.
Or we can utilize ramps for vehicles to prevent that massive concussive impact of jumping down onto the pavement.
Yes, ramps are fantastic.
But okay, here's where it gets really interesting. Because a Pyrenees baseline operating system is already so autonomous.
Right. They are independent.
Yeah, we don't call them stubborn, we call them independent thinkers.
Very diplomatic.
Right. So if a dog refuses to come inside or walks super slowly, how do you differentiate between their standard selective hearing and an actual biological refusal to move due to insidious joint pain?
It's tricky, but we assume biology first.
Okay.
Behavior is a form of nonverbal communication. If a dog that historically sprints to the door when called suddenly takes an extra 3 seconds to stand up or slowly ambles over, the safest diagnostic path is to suspect a physical limitation.
Rather than a sudden onset of disobedience.
Exactly. The owner's role is to catalog these behavioral shifts and the specific contexts in which they occur.
Which establishes a hard boundary, right? We observe the pattern, but we do not play doctor.
Absolutely not. The data goes to the veterinarian. Owners must never, ever administer over-the-counter human pain medications.
Like ibuprofen.
Ibuprofen, acetaminophen, none of it. The canine liver and kidneys lack the specific enzymes required to metabolize those compounds safely.
So it's actually toxic.
Highly toxic. A single human dose can trigger acute organ failure or severe gastrointestinal ulceration.
Wow.
Yeah, so the owner supplies the behavioral timeline, and the veterinarian supplies the diagnostic imaging and the actual pharmacological intervention.
I'm thinking about how pain masks itself, too. Like, an owner might see a dog refusing to get off their bed to come eat and assume it's joint pain. They think, oh, they just don't want to walk to the food bowl.
Right.
But the pathology might be completely unrelated to the legs. It could be in the mouth, which the sources flag as a dangerously ignored area in giant breeds.
It's massively ignored.
Okay.
The sheer size of a livestock guardian dog creates this myth of invulnerability.
Because they look so tough.
Yeah. Because a Pyrenees can crack a femur bone with their jaws, owners assume their dentition is indestructible.
But it's not.
The reality of canine periodontal disease destroys that myth completely.
Let's break down the mechanics of that, actually, because the notes make it really clear this isn't just about bad breath. It is a systemic threat.
It is deeply systemic. It begins with plaque calcifying into tartar along the gum line.
Okay.
That creates a little pocket, an environment where anaerobic bacteria just multiply rapidly. And this triggers gingivitis, which is severe inflammation of the gums.
And it bleeds.
Yes. As the dog chews, the mechanical action creates micro tears in that inflamed tissue.
Yeah.
Those tears provide a direct gateway for the bacteria to flood the dog's bloodstream.
So the mouth is essentially acting as a bacterial reservoir, pumping toxins into the circulatory system every single time the dog eats.
Exactly. And the cardiovascular implications are severe.
Oh, wow, really?
Yes. Once in the bloodstream, these bacteria circulate and can physically adhere to the endothelial lining of the heart valves.
That sounds bad.
It's a condition known as endocarditis. The immune system's constant battle against this systemic bacterial load causes chronic fatigue and hidden pain.
So what do we watch for?
You have to watch for the stoic signs. Dropping kibble from one side of the mouth, sudden reluctance to engage with chew toys, or favoring soft food. Daily brushing and professional scaling under anesthesia are critical, non-negotiable pillars of adult health.
Got it. Now, that internal biological environment is constantly colliding with the external environment, right? The sources highlight that mitigating environmental threats like pests, nutritional demands, and heat requires a highly dynamic approach.
Yes.
A dog living in a high-rise apartment in a dense urban center is fighting a completely different biological war than a working guardian dog patrolling 40 acres of livestock.
Night and day. The tick burden alone for a rural Pyrenees is staggering. And returning to the deception of their coat, a visual check will miss an embedded tick 9 times out of 10.
So you have to feel for them.
The coat requires diligent tactile checks, combined with systemic chemical preventatives that interrupt the parasite's life cycle.
Right.
And the same bespoke approach applies to vaccinations. A veterinarian really must assess the specific pathogen exposure risk.
Like leptospirosis.
Exactly, from wildlife urine and standing water. Or Bordetella if they go to frequent grooming and boarding facilities. You have to tailor the immunological defense.
And the dynamic nature of their environment directly dictates their caloric intake, too.
Big time.
I think of it like vehicles. Fueling a working guardian dog operating outside in a harsh winter is like pouring diesel into a heavy-duty truck.
That's a perfect analogy.
Their metabolism is incinerating calories just to maintain baseline core temperature. But if you take that exact same dog, age them a few years, and transition them to a mostly indoor, sedentary family companion.
Their metabolic engine shifts to a commuter sedan.
Right. And if you keep feeding them the heavy-duty winter ration, they will rapidly accumulate that dangerous internal insulation we discussed earlier.
Which is so dangerous. The caloric load must be titrated to their exact energy expenditure, which changes with the seasons and their age.
And the heat, man. When the external environment shifts to a massive spike in summer heat, it puts an enormous physiological strain on the dog's systems.
Huge strain. Heat awareness cannot just be relegated to mid-July. In warmer climates, it must be a year-round protocol.
And a sudden drop in a dog's ability to handle that heat is a glaring red flag.
Oh, absolutely.
Like if a dog that normally handles a 2-mile morning walk starts excessively panting and seeking shade after half a mile, an owner might just write it off as the dog having a lazy day.
But they shouldn't. You are looking at potential cardiopulmonary distress.
See, just from panting early.
Yes. The heat exacerbates underlying pathologies. A dog with early-stage heart disease or compromised lung function will lose their heat tolerance long before they show a resting cough.
Oh, wow.
Yeah, sudden change in exercise stamina is a primary diagnostic marker.
Okay, so when the external environment or internal pain puts that much physiological strain on the dog's systems, it doesn't just stay locked in the body. It alters the neurological output. It changes their behavior. The deep dive notes make a really sharp pivot here, insisting that we have to view behavior as biology.
Well, if we connect this to the bigger picture, the barrier between the dog trainer and the veterinarian must be dismantled.
How do you mean?
Modifying behavior like curbing night barking, managing fence line reactivity, enforcing leash manners, that's standard operational maintenance. But a sudden, unprompted shift in an established behavior profile is almost always a biological alarm bell.
I want to walk through the logic of this just to make sure I have it.
Sure.
Let's say my Pyrenees, who has slept perfectly through the night for 5 years, suddenly starts pacing the hallways at 2 a.m., barking at shadows.
Okay.
My immediate reaction as a human is frustration. I think, great, we have a training regression. I need to reinforce the quiet command.
Very common reaction.
But if I view behavior as biology, I have to deduce what might be causing that neurological misfire.
Exactly. The logic leads directly to physical distress. If a dog is experiencing compounding joint pain, lying in one position for hours becomes excruciating.
So they get up.
They pace to relieve the physical tension. And because they are in pain, they feel inherently vulnerable.
Ah, and a guardian brood experiencing vulnerability will over-index on their protective instincts.
Exactly. Meaning they will react aggressively to stimuli they previously ignored.
So the dog growling when someone approaches their bed isn't a sudden onset of dominance.
No.
It's a biological flinch. They are warning you not to bump their inflamed hips.
Precisely. Or, if their auditory pathways are degrading with age, they're easily startled, which triggers an aggressive defensive response.
That makes total sense. You cannot apply a behavioral training correction to a degrading biological system. You just have to treat the underlying pathology.
Attempting to train away a pain response only damages the trust between the dog and the owner while allowing the medical condition to worsen.
And that behavioral panic is the outward sign of internal distress. Nothing exemplifies that rapid catastrophic escalation more than the risk of GDV or bloat.
Oh, bloat is terrifying.
The sources underscore that this specter hangs over all deep-chested breeds, and it does not diminish during the prime adult years. We really need to explain the mechanics of why this is so deadly because it happens with terrifying speed.
It does. Gastric dilatation volvulus is a mechanical failure of the dog's digestive anatomy.
Okay.
The dilatation phase occurs when the stomach rapidly fills with gas, expanding like a balloon.
Just getting huge.
Yes. The volvulus phase is the catastrophic event. That massive gas-filled stomach physically rotates on its axis within the abdominal cavity, sometimes twisting up to 360 degrees.
Oh my God, and that rotation pinches off both the entrance and the exit of the stomach.
It completely seals the esophagus and the duodenum. The dog will exhibit unproductive retching, violently attempting to vomit, but nothing can escape because the anatomical doorways are twisted shut.
That's awful.
But the real lethality comes from the vascular compromise. The twisting on the stomach also twists and compresses the major blood vessels, specifically the portal vein and the caudal vena cava.
Which means blood is physically blocked from returning to the heart.
Exactly. The cardiovascular system is essentially suffocating.
Wow.
Within minutes, the stomach tissue, deprived of oxygenated blood, begins to necrose or die.
Yeah.
This dying tissue releases severe toxins directly into the bloodstream.
So their body is poisoning itself.
Fast. The dog's blood pressure plummets and they enter systemic shock. The external signs are clear. A visibly distended, hard abdomen, extreme distress, pacing, heavy drooling, and pale gums progressing to sudden collapse.
This is exactly why the notes are so definitive on this. You do not wait to see if the dog settles down.
Never.
You do not offer water. You have a window of minutes to hours to get that dog into emergency surgery to physically untwist the stomach. An owner must map the exact route to their nearest 24-hour veterinary surgical center before this ever happens.
It's the only way. And proactively, we mitigate the risk by dividing their daily caloric intake into multiple smaller meals.
Right, and strictly enforcing a period of zero heavy cardiovascular activity immediately before and after eating.
Yes, those preventative routines are really the only defense against the anatomical vulnerability.
Man, we have established a massive matrix of variables an owner must track today.
It is a lot.
The subtle biomechanical stiffness, the tactile assessment of weight and lumps beneath the coat, the microscopic shifts in behavior, the dental indicators, relying on subjective human memory to accurately monitor these insidious changes over a dog's lifespan is just a guaranteed path to missing the early warning signs.
It really is. Human memory smooths over gradual degradation. We adapt to the dog's new normal day by day, completely missing the macro trend of their decline.
We just don't see it happening slowly.
Right. The master key to navigating the prime years is implementing a concrete, objective system of data collection.
So what does this all mean for the owner sitting in their living room? The sources highlight an incredibly tactical move.
If you feel a small lump during your physical inspection, you don't just try to remember its size. You take a macro photo of it with your smartphone, placing a coin next to it for scale.
I love that tip.
Right. 2 weeks later, you take another photo. You are creating a time-lapse data set.
You are stripping the emotion and guesswork out of the equation. And tools like the Vital Pet app consolidate this data stream. An owner can log the exact date a slight limp presented, track weekly weight fluctuations down to the ounce, monitor appetite changes, and record the frequency of night barking.
So when you finally walk into the veterinary clinic, you aren't offering vague anecdotes.
No.
You aren't saying, well, I think he's been slowing down lately. You are opening a ledger. and providing actionable historical data. You are acting as the primary biological monitor for the animal, making you an indispensable partner to the veterinarian.
And this really brings us to the philosophical core of adult preventive care for this specific breed.
A Great Pyrenees is genetically wired to spend its entire existence watching over its world. It maintains a stoic, quiet vigilance over the flock, the perimeter, and its human family. It absorbs the stress of the environment just to keep its charges safe.
And what we are talking about today is the owner returning that exact same quiet vigilance right back to the dog. You are observing their biology with the same intensity they use to observe the fence line.
It's a partnership, as the deep dive notes beautifully synthesize. Prevention isn't fear, it's loyalty made practical.
Loyalty made practical, I love that. Implementing this rigorous discipline of data tracking and biological observation during these strong prime years doesn't just prevent immediate catastrophe.
Right.
It lays the groundwork for the next inevitable phase. You are building the medical scaffolding required to manage their mobility, preserve their dignity, and ensure a high quality of life as they transition into their senior years.
The careful work done in the middle years guarantees a more graceful decline.
Beautifully said. Before we close, a critical reminder. This audio is for educational purposes only. If you are ever concerned about your dog's physiological or behavioral health, always consult your veterinarian directly.
Absolutely.
Now, I want to leave you with a final thought to mull over. We began by analyzing a majestic dog guarding its territory, and we built an entire framework around the quiet discipline of noticing, reframing how we look at microscopic physical shifts, tactile realities, and behavioral changes in our dogs.
Yeah.
But consider this. If we apply this exact same level of rigorous, deep, and objective observation to the animals in our care, how might practicing that quiet discipline fundamentally change the way we notice the hidden struggles, the subtle physical shifts, and the unspoken emotional weight carried by the human family members sharing our own households?